prior to withdrawal from alcohol or tobacco. Day 0 of withdrawal from addiction instead of introduction. It is important that a decision to recover from an addiction be your own decision. Working with this book requires your active involvement. Like in sports or in any other endeavor, the result is directly proportional to the effort you put forth. By following this instruction, most people will be able to get free from their addiction in a quite comfortable way. The book is a tool, simulator, roadmap, and an action plan that will enable you to achieve positive outcomes by training, working, making and implementing decisions, and using your knowledge of the problem. This does not mean that the book will abstain from drinking or smoking for you or instead of you, but the absolute majority of alcohol and or tobacco addicts will be able to get free from their addiction by using this book in a proactive and consistent way. What will you have to do first? First of all, you have to understand how to use this book. To do so, you have to carefully read the plan of what you will do. Otherwise, the outcome will be similar to what you get when trying to assemble a vacuum cleaner by yourself. 2 parts are missing and 4 are extra. Prior to withdrawal from alcohol or tobacco. Plan of what you will do. Read, understand, and comprehend. Nothing to be done yet. It is just a plan. The most acute discomfort from abstaining from alcohol or tobacco is usually experienced approximately on the 1st to the 4th, sometimes up to the 7th day. The sense of discomfort tends to weaken and disappear. The dissipation of discomfort should not be confused with the disappearance of addiction. These are absolutely different things. Therefore, most important at this stage are means of mitigating the sense of discomfort, medications, procedures, and exercises. If possible, it is better to use them under the supervision of an addiction psychiatrist. At this stage, it is necessary to lay some of the foundations for building a new lifestyle without alcohol or tobacco. On medications. This is also about the plan, so far for reading only. Everything relating to medications should be studied before the withdrawal, so that on the very first day you have the full package at hand to alleviate your condition. Warning: even the safest medications should be prescribed in a face-to-face consultation with a doctor. All the below data on pharmaceuticals are strictly informational and should not be regarded as a recommendation or prescribed treatment. Days 1 to 4 of withdrawal from alcohol or tobacco. The goal is to reduce the intensity of mental processes. Unfortunately, it is impossible to reduce pathological mental processes only, so the entire psychic activity will be reduced. But you should not be into this too much. This is just a tactical task. Therefore, you may and even have to use mild sedatives. Hypnotics are quite acceptable if you have problems with sleep or feel totally bad. It is better to sleep than suffer. However, over-the-counter hypnotics may prove insufficiently effective. Use medications as prescribed on the label. You must be aware of contraindications and side effects. It is even better if you consult a physician. How to select the right dosage of a sedative medication. you can use the following pattern. If the medication is to be administered 3 times a day, take a half of the average single dose as prescribed on the label in the morning and check the result. Take the full average single dose in the afternoon and double the average single dose in the evening. For example, half a pill in the morning, 1 pill in the afternoon, and 2 pills in the evening. The effect of a sedative medication evolves within 40 minutes to 1 hour after taking the medication. The goal is to achieve a slightly sleepy state where you are neither falling asleep on your feet nor completely awake. Continue with the dosage that has produced the desired effect, either half, full, or double the average single dose. Attention! Medications must be taken strictly at the same time. Time between administrations must be at least 5 hours. In any case, the main thing is to work with information. You will never win without understanding what you are fighting against. The main difficulty in treating an addiction is that many think everything is very simple and clear. This is a common misconception even among doctors, including psychiatrists and addiction therapists. But in fact, almost no one can clearly explain anything. Even once everything is explained, more than 3/4 of people continue to make the same mistakes as before. First, read the instruction slowly and thoughtfully. Second, read and make notes on what is clear and what is not. Third, read and try to understand the questions that arose when you were reading the text the second time. Look through the notes you have made. Assess your condition. Throughout your work with this book, you will assess your condition by answering questions once every 3 to 5 days. You can plot a chart using your score and make assumptions. The condition has improved, your score is lower, or the condition has worsened, your score is higher than before. Days 5 to 7 of withdrawal from alcohol or tobacco. The number is notional. It may well be day 3 or 4 or 5 or 6 or 9. A typical characteristic of the second period is that in most cases the discomfort from withdrawal from alcohol or tobacco is either completely gone or remains at the minimum level. The approach, if something hurts, get some sleep and you will feel better, is no longer applicable. Medications will not produce any considerable improvement in your condition either. On the one hand, you may feel euphoric due to withdrawal from alcohol or tobacco. On the other, you will see a lot of problems that were not so obvious before. Plus, you will get significant time and energy resources that were previously spent for the alcohol or tobacco use. You should continue to support your body and slowly start to be more active. Try, experiment, and select new elements of a life system for yourself. In addition, systemize your knowledge about the addiction, its manifestations and features of its progress, because it is still there. Material for building such a system can be found in this book. You should be guided by your sensations and results of condition assessment. If you feel well, the addiction has not become acute, and you do not want to drink or smoke, then you can try and start reducing the dosage of sedative medications. From day 8 to 12 of withdrawal from alcohol or tobacco onward, all of the resources of your body should be involved at 200%. You should not let any single free joule of your energy to the addiction. Addiction has no resources of its own. It just parasites on you. Therefore, nothing should be left for it. Let the disease starve. New life, new fun is a global trend. You will get more time and resources. Spend them with pleasure. Examples: sweets as a replacement therapy, but don't get too much into it. Various delicacies, spa and physical exercises, and sex, of course. As the most powerful source of endorphins, your sexual life should be more active and diversified. Sleep, other than induced by medications. The more you sleep, the better. Say it is prescribed by your doctor, for it is good for your health. Laughter. It is not only prolongs your life, but also considerably improves its quality. Hospitals in Japan, for example, use a psychotherapeutic technique where patients with later stages of cancer get together to laugh at their disease. Medications become less significant. The course of administration should be in accordance with instructions. In case of a slip, which must be avoided, use the crisis kit. We'll talk about it in one of our next videos. The main thing is that you should not only know, but also be able to use your knowledge. Then the addiction will have by far fewer chances to misguide you. All of the above was about an action plan. In our next video, we will look into the specifics.